Well, our next guest can certainly help me. I don't know about you, but as we get older, many of us wish we had longer arms like this so we can read what's in front of us. Literally, this is how it is for me. But thanks to new technology, it is changing that. And here to explain is Dr. Richard Blue from the Blue Laser Group. Thank you for being here, Doctor.
Christine, great to be here with you.
Well, I appreciate the fact that we're talking about this because I am 46, and apparently this is something that starts to plague people.
Perfect timing for this.
Right, absolutely. And congratulations, because you are the first surgeon in Georgia to perform a new procedure addressing this over 40 vision issue to help patients reduce or even eliminate their need for reading glasses. So, amen to that. Tell me all about it.
Well, the camera inlay is something brand new, obviously. It's the first technology we've ever had that actually corrects near vision. So if you think about it, that's a pretty big deal.
Absolutely.
Because we've never had anything like this before. There's been a recent FDA study that gave clearance to the camera inlay that was completed in April. There were 500 patients in the study that were followed for 5 years, and the FDA made sure that the procedure was safe and effective for patients, and that obviously turned out to be the case. And so 4 of us in early June did the first procedures in the country, and I've since done 30 procedures, and which actually makes me the most experienced surgeon in the country doing commercial camera inlays. But patients might think, wait a minute now, even though it's been an FDA study that looked at it hard, I'm not doing anything that's new. So it's new, but it really isn't new, because it's been done over 20,000 times in 33 countries.
Wow.
So the information and the technology has been refined and refined. And the beneficiaries are the U.S. doctors and obviously the U.S. patients, because they gave us a procedure that in experienced hands allows the patients to get just spectacular results.
Fantastic. We can toss out those readers then.
Yes.
Okay, tell me how it works. And by the way, it's called camera inlay?
Camera with a K, because it actually works like a camera.
Okay, cool.
Now, the procedure is actually done in my office. It's done in a laser suite.
Wow.
And the whole thing literally takes less than 15 minutes to do, sometimes 10 minutes. Before I do anything to you, I put numbing drops in, and we also give you some Valium, so you don't feel what I'm doing, and you really don't care about what I'm doing.
Exactly.
Which is really a big deal.
Right.
But the procedure, again, is over in 10 minutes, but you don't care because you've had your Valium. And the procedure involves me using the femtosecond laser, which is a device I use for LASIK to create a flap. In this situation, what I'm doing is I'm creating a little pocket. And into that little pocket, I put the inlay. And the inlay is a device that's 3.8 millimeters across and 5 microns thick, which means it's about the thickness of a human hair. So it's a little microfilament, and just slides right back into that position. And literally the procedure, as I said, is over in 10 minutes. And what it does is it creates a pinhole effect and restores depth of focus.
Right.
Like your eye is supposed to work, like it worked when you were 30.
Right.
And gives you back really good distance, really good near vision, but doesn't do anything to take away any of the distance vision, which is a really remarkable part of it.
That's incredible. So can it correct any potential vision problems? Like, so if you're already having issues, that's one thing, but is it more preventative or just once you have the issue?
The inlay is done in patients typically around age 40.
Okay.
And 40 and beyond, it works equally well in a 50-year-old, a 60-year-old, a 70-year-old, so it's not age dependent.
Okay.
And the other thing that's remarkable about it is that it will last. So when I put this in a 45-year-old, they'll come back to my office 10 years later at 55, and it'll still work just as well.
That's phenomenal.
That is phenomenal.
Yeah, and talk about then the perfect candidate, somebody 40 or up.
40 or up.
Okay.
And someone that's sick of their reading glasses, and often you have 20 pairs of reading glasses. They're on every cabinet. They're in every drawer. And sometimes they're on the top of your head. In spite of that, you still can't find your reading glasses.
I know. That's my husband, actually. Yeah, me too.
I see that a lot.
Well, you know what happens for me is I just forget to leave them around, so I'm not even addressing it. So instead, I really am just like that. Or even I've noticed reading the teleprompter sometimes. It's terrible.
You know, we can fix all of that.
Thank goodness. Thank God for you. Okay, and let's go and talk about the actual benefits. Obviously, you're going to be able to see.
Right.
But kind of walk us through. I think we have a graphic of what it's going to do to patients.
Well, the tremendous benefit is it gives you back your near vision, and you don't think about how many things you used your near vision for until it's gone. So it allows you to see your computer screen, your cell phone, everything you want to see up close without taking away any of the distance vision. So that's the phenomenal characteristic of this device, is that it restores near vision, but like anything else we've ever had before, it retains your great distance vision.
Fantastic, good. Yeah, because what's happening, at least I know with a lot of people in my age group, is the distance vision isn't a problem at all. It's just that close one. And we're looking at a picture right there. We're showing kind of the before and the after of what somebody will see. Describe what we're doing here.
And what you notice is the distance is not going to change.
Right.
The patient's looking at a book on the left-hand side. It's blurry.
Right.
But what the inlay does, it clears up the book. So your
Look
distance
at
vision
that.
remains good, but now you can see your book again.
Yes, thank goodness. And what are some other options, let's say, for somebody who might not be a good candidate for the Karma Inlay?
Well, the great thing is that virtually everyone that comes into the office will be a good candidate for the camera inlay. So it'll be a rare person.
Okay,
but
good.
the question you ask is interesting. What have we done about presbyopia or the need for reading glasses? How have patients dealt with this over the years? Interesting enough, in Roman times, they actually hired people to read for them. Now,
Okay.
That's fairly impractical.
Yeah, very impractical.
And then the next solution was the bifocal invented by Benjamin Franklin
Yes.
250 years ago. So the majority of people in this country, and actually worldwide, the solution they have for problem seeing up close is they wear the same device that was invented 250 years ago. So don't you think it's time we had a better solution to
It
that?
sure is.
Yeah.
Absolutely.
And the next solution was monovision. It's been tried with contact lenses. It works relatively well. And monovision can also work with LASIK, and I'm a good example of that. I've had LASIK myself.
Okay.
And I don't have to wear glasses for anything distance or up close.
Wow.
So it turns out about 60% of my patients can do monovision and do well. But about 40% of my patients just can't deal with one eye for distance, one eye for up close. And that's the perfect person to have the camera inlay.
And that's Dr. Blue himself getting the procedure done. So yeah, you obviously have this unique perspective as a patient and also as the doctor.
Right.
So
And
that's wonderful.
People often ask me, what's your most memorable procedure? And I've done my own son, not with the inlay, but with LASIK. I've done my
Sure.
own son. I've done my wife. I've done multiple family members. I've done my own friends, and I've done many patients that become friends since I had the procedure myself.
Right.
But when I had the procedure myself, it gave me a really different perspective.
Yeah.
I had no idea what my patients were actually seeing and feeling. So I can honestly say the day I had my procedure, I probably became a better doctor.
Ah, fantastic. That's great. So many people out there. I know our viewership, according to, our demographics, are right here in that 40s. So
Absolutely.
if you need help, please contact Blue Laser Group. Where are you located, Doctor?
Located in the 316 Professional Quarter in Athens, Georgia. It's just a short drive down
Yeah.
316.
Well worth it to finally get your vision cleared. Again, that number is 888-237-BLUE. That's 888-237-BLUE. Or go to bluelasergroup.com. Again, that's bluelasergroup.com. Thank you again, Doctor.
Thanks for having me on.
Thanks for making the trip. Great information.